Well, hello, my name is Jody Scholes. I am your instructor for the MBLEX review class, and I want to say welcome. Welcome to all of our graduates that you can see here. This is representing a larger community on patreon.com/Jody Scholes. And that's where we gather during the week to inspire, to motivate, to check in, to ask questions. But once a week, we come right here to our live class and we prepare to pass the MBLEX. Class is done in 3 parts. The first part is a little bit of strategy. Yeah. So giving you a little bit of strategy on what to expect with the test. Some schools go over what to expect, some schools don't. I like to walk you through what you can expect in taking the test and give you some tools for your toolbox that equip you to take the test. So that's part 1. Part 2 is we're going to learn, we're going to review, we're going to go back over what you learned in school and just freshen you up on the best answers. Because many, many, many of you know the right answers. And sometimes a right answer keeps you from choosing the best answer. So because of that question, in the third part of class, we go over dissecting questions, where I have put together a series of questions that have distractors in the answers and in the questions. The practice exam that is a part of this community, part of this coursework, is designed to be hard. Most people don't even score 50% the first time they take the practice exam with me. That is because I want to give you, it's not that I don't, I want to give you a realistic experience of what the test is like. And for many of you, you've already taken the test. The reason you're here, the reason you found me is because you've failed this test at least once. In fact, I got permission from, I'll wait for it, Darius. Darius was one of our graduates and one of the people who passed the MBLEX this week. We had two people, and it was Darius's 5th time. And I said, Darius, 5 is your new lucky number. And it was. He spent the time he needed to here, not only with the information, with the learning, with the anatomy, the physiology, the pathology, blah, 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 but also learning how to take the test, learning how to get game day ready. And that is the first part of our class today, is what does it mean to be game day ready? And so thinking of your MBLEX day as your game day. So if you played a sport, then you'll know what I'm talking about. But imagine you've played baseball or you follow a team. Maybe you're a sports fan and you follow a team. But just imagine in your head that you're going to the game, whether you see yourself as a player or, a participant, a player or a fan. It's game day. What do you do for game day? If you have never been to a professional sporting event or to even a little league game, you may not know. All right, what do I bring? What do I wear? What can I expect? But you like to know what to expect on game day, right? And that's what we walk you through here, what to expect on game day. And you can expect, well, you already know that you've signed up for a test, right? You've gotten on there, you've gotten your authorization to test. But the most important advice, some of the most important advice that I can give you is do nothing new on game day. No fancy breakfast, no, no new food. Maybe you want to eat a big breakfast because you like breakfast, but no new food at your breakfast or your lunch that day. You want to try something new, you can experiment later on. I'm talking not even like new socks, new underwear, nothing new. Nothing you haven't already worn, at least for the day. Because you don't know if these outfits, if these clothing, this hat, these socks, they may be uncomfortable and they may be distracting. Nothing new on game day. So take the same route. You'll hear me advise you, and I'll advise you again, to go ahead and drive the route to the testing center so you know where you're going. Yeah, some of you got to drive a ways to get to the testing center, and you may consider getting there the night before and staying at a hotel. I've had a number of students do that because the testing center was over an hour away. And you just want to keep things simple on game day, right? Just keep things simple. So whether and when are you at your best? Are you planning to take that test in the morning, in the afternoon, or in the early evening? Knock it out, get it done, my suggestion. But it depends if you're a morning person, right? So plan your game day. Think about what you're going to wear. Think about the car you're going to drive, or if someone's going to drive you. We plan these things out so that you can control what you can control on your game day. Additionally, you're going to plan what you do after the test. You can plan your celebration. And if you have the experience of failing forward, which if you're listening to my voice, I don't think you will, but just in case, doesn't matter if you failed forward, you're still going to celebrate. You're going to celebrate the next milestone of that much closer to being a licensed massage therapist. Yeah, sure. What the hell? You failed forward. In the past, you failed forward. Now we are investing in your positive preparation for the MBLEX. And hey, some people think they're ready and they're not. Feel free to ask me. Feel free to reach out and ask me if I think you're ready. However, plan your reward, because whether you're rewarding yourself for the effort you've made up until now, or you're rewarding yourself for that effort plus passing and celebrating passing, plan that positivity for at the end of the day, for at the end of the day that you take your MBLEX, your game day. So whatever that looks like for you. So that is how you mentally approach your game day. Nothing new, keeping things controlled, control what you can control. Yeah. Being around positive people. You're controlling what you can control. Yes. Plan who you're going to call with the good news. You better be texting me or sending me a little note, whether it's email or through Patreon or via text. Because, I really do celebrate with you. And it's a big motivating factor for me of why I'm here every week, is because I celebrate with you. When we launch a new qualified licensed massage therapist into the world becomes a better place. And so let's get to that, shall we? That'll be in part two of our class, and that is the learning. And today we are doing client assessment. Client assessment, reassessment, and treatment planning is a part of your MBLEX. It'll be approximately 12 to 15 questions on your MBLEX, but we are going to specifically talk about doing what is involved in the client assessment, reassessment, and a few of those fun factors. All right. All right, here we go. So this is client assessment, reassessment, and treatment planning. This is an official part of what you need to be familiar with, this language and these concepts, as you take the MBLEX, and also to have safe, productive therapy sessions, client sessions. Oh, I want to say thank you to Laura Allen. Sometimes I go to her book for some questions or for some concepts. This happens to be the 3rd edition, but Laura Allen is phenomenal in her experience as a licensed massage therapist, as an educator. She's been around longer than I have, and I've been around 2 decades. So just a shout out to Laura, because I did I reviewed her client assessment chapter in preparing for today. All right, so here's what the Federation of State Massage Therapy Boards tells us is a part of this content. So how to organize the bodywork session. This will include your client consultation. And this is your verbal intake, the health history form, and then written data collection, so SOAP notes, visual assessments, both general assessments and postural assessments. We'll talk about what those are. Palpation assessment, what that is. Range of motion, to understand more specifically what is range of motion, and how might you be how will you need to prepare to understand range of motion is what we're talking about today. And then you're going to use some clinical reasoning. And this is your ability to rule out contraindications and your ability to formulate a treatment strategy. So let's get into it. Okay, so what is the order of a client assessment? Well, we're going to do the interview. The client interview starts with that one-to-one time, right? Now, here's a challenge. In real life, if you go to work for some franchises, you are booked back to back on the hour. And some therapists have reported they do not have a lot of time to do a client interview. Never mind a visual assessment or a palpation assessment. But in a perfect world, you would do the client interview, and that would be your dialogue with the client. And then we're going to look at potentially if they need us to do a visual assessment or a palpation assessment. Let's take a peek. All right. So the components of the client assessment are a discussion and a review of the health history form or the health intake form. So you might be inclined to do movement analysis. Did you see something when you were walking down the hall, or when your client was walking in, or when your client was getting up from the chair? That tells you may need to assess movement. You might do a postural analysis. There are some special tests we're about to talk about. You may be asked on the MBLEX about a palpation assessment and what you'll be palpating for. And you might be saying, wait a minute, Jody, palpation assessment, I don't even know what that is. You know what that is? It's when a client says it hurts right here. And they say, touch this. Or they say it's somewhere, it's like in my mid back. And then you find the spot during the discussion. So they're still fully clothed, but the client points to an area and then you touch it. Palpation, to palpate, to touch. So they say it hurts right here, and you say, tell me when I'm on the spot, that they're fully clothed. Just so you're getting an idea of where it actually hurts. And if you're trained, you might even take vital signs during the client assessment. That's in a more medical setting. I mean, maybe in a chiropractic office, but that if you're trained in it, it's not out of the scope of your practice. But it's not a part of traditional client assessment. Client assessments can be as long as 15 minutes, especially if you're working with a new client with a complex health history. They come in and their health history is all filled out and they have a list of their medications. It's going to take a little time, right? Yeah, it is to be thorough. This is one example of the health history form. A lot of times there is an area where the client can actually mark where they have felt pain. If you don't have a health history form, Several of your books will have a health history form. This particular one does too. Your school books will. And you know what? I can send you one, or just Google health history form massage. Boom, a whole bunch pop up. If you want to see what is on there, what conditions are on there to review. And you will want to be familiar with each of the conditions. You don't have to know them inside and out. You don't have to know epilepsy inside and out. You know what causes it and da, 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 da. You don't have to be an expert in epilepsy, but you do need to know the session adaptations that come along with epilepsy. Someone who has epilepsy, you will want to have completed your first aid and your CPR training. You can do that right now, by the way, in preparation for passing the NBLEX. You could take first aid and CPR right now. And they go through, in first aid, they go through all of these pathologies that are on your health history form and talk to you about how to treat if someone has a seizure, if someone goes into cardiac arrest, if there is an emergency situation within your treatment room or within the office that you're working in. Your first aid training will equip you to attend to that patient, to that client, until emergency help arrives. And one of the very first steps is have someone call 911 and then attend to your client or to your patient. But looking at this health history form, your first aid and CPR training will support you in understanding these conditions that are on the health history form. Oh, and by the way, there are gold in them there hills. What the heck does that mean? What that means is there's gold in the client interview. They will remember things that they forgot to put on their health history form. Things that could impact your session. So as far as the NBLEX is concerned, you will always do a verbal intake with your client every time your client comes in. It might be as simple, maybe you see them twice a week. Hey, how are things going? Where would you like specific attention today? How's the body? I mean, I see some clients twice a week, and I still ask them, what are we focusing on today? Or is there something to focus on today? Maybe the focus is relaxation, and that's fine too. But there's gold in the client interview, in the discussion that you have before the session. And one of the things I'll point out is, do you see here how this client interview is being done sitting at the same level? I don't know if you'll get this question on the NBLEX, but best practices is to sit level with your client. If you sit on the treatment table and they sit on a chair, what is the position? There's an implied body language position that because you are higher than them, it's in authority, and they may not be as comfortable. This is also a time where you want to build rapport with the client. Sitting evenly with them is the best practice when it's available. So what is the order of the client assessment? We've just talked about the client interview, and now let's move on to a visual assessment and palpation assessment. But first, visual assessment. So visual, what are you seeing? This is also a part of SOAP note charting. And let me move us over here. And in the chat, hey there, here's the chat. In the chat, if you would please tell me, what does SOAP stand for? When we say SOAP note charting, what does SOAP stand for? And visual assessment is a part of that SOAP note charting. Once we've established what SOAP stands for, I'll tell you what visual assessment, what category it goes into. Oh, there we go. Very good. Thank you for the direct message. There is, all right, Val's on it. iPhone is on it. I'm not sure whose iPhone. No. Anyhow, hey, iPhone, you got it right. Yes. And Val, yes. Ensley, let's see. Yes. Good. Good. Oh, hey, Diana. Great. Thank you. Super. All right. So visual assessment, and what you're seeing here is a very formal visual assessment, right? This is done with a grid. And if you can see over here, let me put this over here again. So this is a visual assessment. It'll probably look more like this on the left for you because your client will be fully clothed. But now and then, if you want to do a more thorough visual assessment, you can assess in something they would wear to the gym, maybe a spandex, a legging, a long legging is still fine. Then they don't need to be in shorts. They can be in a t-shirt. They don't have to be in a jog bra. But take a look at this postural assessment. This is done with a plumb line. So a plumb line is a weight on the end of a string. And imagine this red line was a string. And then this would be a weight. And so when you see this midline, and in some of the charts we just have, like here on the left, we just have that midline of the body. Not quite as easy to see. But take a look at the dots here. This is the midline of the body. Everything is cool. But all of a sudden, she's a little off. She's a little more to the right. Like that midline isn't directly so. Her sternum is a little bit more right of the midline. Her xiphoid process is a little bit more right. And that starts to happen here. And so we can see potentially there's like something pulling her to the right. Are you guys able to see that? And another option for the postural assessment is in the visual assessment is assessing from the side. And so here's the midline of the body. We start here with that plumb line. And we just want to see if things are in alignment. Oh, see how this shoulder is a little rotated forward? Just a little bit. Everything else, that ear might be a little forward. Maybe a tiny bit of forward head posture. But overall, pretty good, right? And this, see here, is the door. And maybe in your treatment room, I don't know what environment you're going for, but a postural analysis grid, postural assessment grid can just be tacked to your door. It's an option. Just wanted to give you a visual of what that looks like. Okay. So we've talked about the visual assessment. Let's talk about the palpation assessment now. So we've done a discussion and we realized, oh boy, this guy, this gal has a complex health history. And when they walked down the hallway, I saw something I'm not quite sure. So you did the visual assessment. And actually, sometimes I'll show you here too. Take a look at this visual assessment. I'll stop the share here for a moment. Oops, come on back. Because you can do a visual assessment. And for me, take a look here, left to right. Do you see a difference in the height of my trapezius on the left versus the right? That, what you just did, is a visual assessment. You're like, hey, that left trap, what's up with that? Take a look. See how it attaches a little higher? Maybe you didn't see that before, right? Yeah. So what might that tell you from that visual assessment? You might be seeing, that left trap looks like it's going to be pretty tight. Or maybe maybe you want to ask the client about that. Hey, do you have any discomfort in your left trap? Would you like me to spend any more time there? I noticed it might be a little tight. You just used your visual assessment to do treatment planning. Bang, just like that. Now, personally, my left trap doesn't bother me at all. And I actually tell people, stay away. Don't bother because it's been like that for a really long time. And there's no need to waste time working on that when I've got about a million other things you could be working on. So I actually say don't bother. But the fact that you noticed tells me you're paying attention, tells me you're treatment planning, tells me you're using your intellect, what is sometimes called critical thinking, to plan a session. Now, if you saw this on a client, you may be motivated to palpate, to touch. Let's take a look. Palpation assessment is simply what it sounds like. It's a physical exam, and they don't have to disrobe. You can palpate straight through the clothing. But what are you looking for? You're looking for the tone of the tissue. You're looking for, does it move? Does it hurt when I touch there? We're looking at temperature. We're looking at pliability. We're looking at the elasticity of the muscle. And we're palpating the tone and quality of that soft tissue with a touch. Here's the other beautiful thing we're doing. I think it's in the next slide. Oh, in the next slide. First, why? Why do you want to touch your client? Well, when a client says, oh, it hurts right there, and it may not be right there. It might be lower, it might be higher. The perception of where the pain is could be different from where the actual pain is, and it can be different than where the trigger point is. Trigger points sometimes produce referred pain. And so if you press on an area and another area hurts, so sometimes the referred pain from a trap or the occipital ridge refers to behind the eye. You have found a trigger point. And so where the pain is may be different in the client's mind as to where it actually is on their body. Palpation is very helpful to you as an assessment tool to meet the client's goals for the session. We also want to assess, we're looking for temperature, as we mentioned, because warm tissue typically is healthy tissue. Cold tissue could be a lack of circulation. What about overly hot tissue? It's like, whoa, this foot feels completely different than the other foot. What's going on? So you'll be sensitive to the changes in that temperature of the tissue, what's happening with the circulation, and also when you palpate, those healthy muscles move freely. So palpation can be a great tool for you in your sessions prior to the start of the session. I want to mention one other thing about palpation, and that is that when a client says it hurts right here, you are immediately building rapport if you palpate and identify the point that they're talking about. It shows you're interested. It shows you care. It shows that you might actually be intending to treat that area. One of the most important things to do in building a healthy therapeutic relationship with a client is to listen and build rapport. Listen. It's the client's goals that we're looking for. Look, we know that sometimes the pain might be here, but we have to treat here. We still need to keep the client's goals in mind. One other way that we can help to achieve those client goals is through, and you may need to know this for your MLEX, is through the special tests, which test range of motion. So range of motion, ROM, abbreviated. You may see that on the MLEX, ROM, range of motion. And we're going to be using range of motion tests to see if there's any restrictions. Now, the test you're seeing here is called the Thomas test, and it is before the client can do this fully clothed. They lay down on the massage table, if it's comfortable for them, with their knees over the end of the table. And then they bring one knee to their chest. And you can help them with this, or they can start with one knee at their chest, depending on their health and range of motion. But the Thomas test is when this knee, we're seeing here the right knee, is brought up to the chest. And on this example, the left leg stays on the table. This is considered a negative test. That means nothing is happening. But on occasion, you may see, and maybe more often than not, when this knee is brought up, the left leg rises. And when this left leg rises, it means that there's some tension in the hip flexors. And so some of my clients come in and they ask for work. Oh, my hips are tight. Let's figure out what they're talking about hips, because they're talking about something in the pelvic region, right? So let's maybe throw them on the table first and just see if their hip flexors are tight. Because hip flexors take a minute to work on, right? That's that front of the leg, this area right in here. Thick, taut tissue needs to be warmed. It's where hydroculator, heating pad, moist heat might come in handy. But this test will determine, it's a range of motion test called the Thomas test. It's considered a special test in client assessment, and it is within the scope of practice for you. So during tests, range of motion tests can be done on the table. They can be done standing up. They can be done sitting down. Range of motion tests are normally done fully clothed. Once your client is on the table, that ship has kind of sailed, because we're trying to drape. And so we want to interpret the movement and rhythm through a range of motion test. There are 3 types of range of motion: active, passive, and active assisted. Let's walk through them. Passive. This is where you move the client. So the client is laying on the table. You'll see again, fully clothed. And we are going to move a limb. They are not going to help us. Sometimes I use the word, okay, if I'm moving an arm, okay, can I have the weight of your arm? Could you be like a rag doll? Remember that from school? It's like when we first started working on each other, and it would be like, here's my arm. Massage my arm. It's all tight. So that is not passive, right? What we're looking to do is get that nice wiggle. And so with the leg as well. So in this example, on this image, the therapist is assisting and asking the client, no, don't even help me, don't touch, although the client is touching in this picture, but I'm going to take this leg through a range of motion, and we're going to see if there's any restrictions. Does it hurt? Can we get a full range of motion? The therapist is actually looking to go to what's called the end feel. So if we were doing this particular test with the leg, we would bend the knee, we would support the knee, support the ankle, and bring that knee towards the chest. Usually the hands are by the sides. And we just want to get to where the end is. This is called passive range of motion. The client is not helping us. We are moving the leg. The client is passive compared to active range of motion. So active is the range of motion when the client is doing the moving. So in this particular example, you'll see a client is sitting in the chair and we say, please, with the palm down, raise your arm up by your side. Go ahead, and if it's safe to do so, do that. Go ahead and moving that palm so that it's facing forward, bring that arm up towards your ear. Great. Let's go back down to neutral and go ahead and bring that arm across your body. The client is active. I'm not helping, I'm not moving them, I'm observing them go through an active range of motion. So the three types, passive, active, and then what would you think active assisted is? I'm helping her raise her arm. I'm standing behind her or him, and I'm assisting. Let's see how far that range of motion can go. Oh, I can't go any further. It hurts. Okay, go ahead and I'll assist you with that range. Did that change the pain level? We have a pain scale that is 1 to 10. And we can say on a scale of 1 to 10, how much does it hurt? That information is documented in the SOAP notes as objective. As subjective. So, and I forgot to mention the correct answers from our SOAP note question. Let's move away from this slide. SOAP notes, S-O-A-P, do stand for subjective, objective, assessment, and treatment planning. So planning, but what kind of planning? Treatment planning for the future. So subjective, what the client has told you. Scale of 1 to 10, that's a subjective opinion, right? They're the only ones who can know. In fact, what we talk about next is signs and symptoms. And subjective are symptoms. So it's what the client is feeling. Let's scoot down to symptoms because they're not apparent through visual observation. They can't be seen in X-rays or MRIs. They're experienced by the patient. Sorry, I'm hearing a funny noise. So the symptoms are what they're telling you about, and that is their subjective experience. But signs, that's where the visual assessment, your postural assessment, that can be considered objective. Signs are objective. They're observed. They're detected. They can be seen, felt, measured. The signs are objective information that we are going to then interpret to assist us with our treatment planning, our assessment of the client, and our treatment planning. So signs, you can take the vital signs. That's a measurement, right? Blood pressure, heart rate. So signs, when you do that sideway postural assessment, so if you're looking at me from the side, right? Again, I'll just throw this hair up so you can see what I'm talking about. Forward head position. Head that is straight in alignment. Forward head position. We had a great conversation about which muscles get short and which muscles get long. So let's look at that with this. Do we have time? We do. All right. So if I've got forward head position, I drive all the time. I'm on the computer all the time. I'm on my cell phone all the time. I might live in this world. What muscles are going to be affected? What muscles in this particular posture would you say are long, are elongated, have lengthened, have had to lengthen to support the weight of the head? Are these muscles long? Anterior? Or are these muscles long? Posterior. I'm telling you, you might get these type of questions on the MLEX. They're going to talk to you about the scalenes and the SCM. Forward head position. Which section, just let's start with which section, the anterior or the posterior, have had to lengthen? I'm looking in the chat. Yes, Paula, yes. Yes. Uni, yes, posterior, right. And yes, I did carry my massage table or purse a lot, but it's just, it happens. The left trap happens sometime. I don't know. Good, yes. And so those posterior, but you know, the weird thing is when we think about forward head position, we're like, oh my gosh, we have to treat this, right? Well, let's treat both the anterior and the posterior. I mean, so it's the posterior, the muscles have lengthened to support the head. So you may find them to be hypertonic. Hyper, toned. Hypertonic, what's a hyper kid? Right? Hypertonic, hypertoned. So they've stayed locked on to help support that forward head position. Good, Val. Yes, good. All right. So signs are things we can see that you can visually document. And you might do a gait analysis. You might feel the tissue firmness. You might feel a cool foot, a hot foot. You might see a rash. Those are all signs. You can see them. There is no disputing. You might dispute how much, but if I take your vital signs, if I check your blood, your heart rate, I'm going to get a pulse. I'm going to read it. I'm going to write it down. That's not something we normally do for a massage session, but I'm using that example to demonstrate that it is concrete. It's like, okay, objectively, I see forward head position. Someone else might not see it. But if I'm doing the SOAP note charting, then my objective opinion is documented in those SOAP note charts. Now, symptoms, that's what the client told me, right? So, oh my gosh, I feel tired all the time. I wake up in the morning and I'm super thirsty. The pain scale on a scale of 1 to 10. Where's my pain before starting the session? All right, you get the idea. I want to cover one other concept, and that's called informed consent. And it's actually one of the most important parts of your client interview, of your intake process, because you've gotten written consent, right? They've signed off on, yes, I've told you everything to the best of my ability. And you now need to consider verbal consent. And this is an MBLEX tricky question, right? Best off to have them sign everything. I'm pregnant. I sign off that I've told you I'm pregnant and it's not high risk. I'm a minor. My parent has signed off that I can be seen for a massage as long as they're in the room. All that's that's written consent. Informed consent also happens usually prior to the session beginning. Are you going to work on their glutes? Are you assessing a condition that needs abdominal region work? Have you gotten into the massage and you realize their adductors are so tight, their groin, that muscle that runs between the inside of the knee up the inside of the leg, it's like their IT band is super tight and their adductor is super tight, and you didn't realize that before the session? What do? You need to, at that point, verbally let them know where you're going to be working to receive informed consent. And this is done before the drape. So if I am working the gluteal region, I will touch the lower back. I will go to the iliac, to the posterior superior iliac spine. And I'll just have a soft fist and say, I'm feeling like you need some work in this area. Is that okay with you? And you wait for a response. That is an example of informed consent, verbal consent during the session. Another area, let's see, let me move us over here so I can ask a question. Good. So what other areas, so we've talked about the glutes, the butt, the abdominal region, definitely needs informed consent. Adductors, where else? Where else might you want to let your client know, hey, I'm going to be working in this area. I'm going to drape, but I feel like you need some work in this area. I almost touched it. Where else might you need informed consent?
In your pector and minor, your pectors.
Did you say pecs?
Yeah.
Yes, exactly. So you're going to want to bring that arm up and over the sheet to nice tight drape. Or if they're chilly, you're going to take that sheet and tuck it under their arm so that sheet stays nice and tight, right? This is another part of building trust, building a healthy therapeutic relationship, building rapport with the client, that you are being intentional with your drape. I see another. So Paula was told to ask for face, abs, glute, feet. Yes, absolutely. And I would say also, if you feel like, if you see some type of body posture, rolled in shoulders, let them know I'm also going to be working just above and just below your collarbone. If you guys don't do any work below the collarbone, try it sometime. Oh, it's so nice. Ask for it sometime. It's really nice. All right. That's what's called informed consent. We get it written. And if mid-session, we need to move into one of those areas, face, abs. Abs would be something you'd probably assess ahead of time, but pectoralis, chest, no exposure of the breast tissue. So when you do abs, how do you not expose the breast tissue? Towel, right? A very secure towel, not just a towel that's like a little face cloth. Secure that drape. You're going to hear me say that like over and over again. Thank you, Pumla. Pumla says the décolleté. That's right. That's the area called the décolleté. Yes. Do I go below the collarbone in between the intercostals? Yes, that's exactly what I do, Val. I find my way, I glide under the collarbone, and then I work along right here, this sternum, the edge of the sternum, and I find those little areas where the rib head is, and I go in between them. But I don't go any further than about here. And if the coast is clear, if I haven't draped them so their shoulders are covered, if I've draped them with their arm out, I will follow that glide all the way out to the top of the deltoid, all the way out. It's just a nice opening of the chest. Okay. I believe that is our, we have a few more things to cover, and then we're going to dissect some questions. So client relationships do depend on healthy boundaries. And one of the ways that you establish healthy boundaries within your treatment, during your treatment, is with secure draping, with verbal consent, informed consent beforehand. Those all establish your professionalism and help you to build rapport. And this is a time where you can think about, in your sessions, how do you build rapport? Because building rapport is needed to build trust, establish clear communication. If they don't feel comfortable with you, they are not going to tell you that it hurts or that they're uncomfortable. So we need that rapport for clear communication and to grow and maintain healthy therapeutic relationships. So you got to talk during your sessions now and then, at least talk before your sessions, to establish your professionalism and create those healthy boundaries which build rapport. All right. So since we have been through local and contraindications, local and general contraindications in the past, we are going to scoot right through to dissecting questions. All right. There we go. We are switching gears. Ugh. All right, I'll just go through them. I didn't want to have to go through these. There we go. So now we're about to dissect questions. All right. With client assessment questions, they're often long. So, first question. What must a therapist establish with the client in order to build trust, mutual understanding, and is needed for a healthy therapeutic relationship? A, time is the only thing that will establish trust with a client. B, rapport. C, explain the plan of treatment to the client before every treatment. This assures the client won't be surprised by where you work or the modalities that you use. D, have your diploma and resume or credentials on your website so clients know you are qualified. So what must a therapist establish with the client in order to build trust and mutual understanding needed for a healthy client relationship? Ooh, we see some answers. All right, we just talked about this, so yes, good. But let's go ahead and eliminate one wrong answer, because that is ours to do. Time is not the only thing that will establish trust with a client, so that is not true. And you guys got it. Good job. Letter B, rapport. When you build rapport with a client, you're establishing that trust. So nice work on Ensley and Paula and Diana. Yes. Nuyo. Uni. Yep. Val. Yep. Good. All right. Next. Next question. What is the form of a question that requires a more detailed answer than yes or no? What is the form of a question that requires a more detailed answer than yes or no? Now think about this. We're talking about client assessment, right? Okay. A, open-ended question. B, true or false question. C, when we ask a client questions about the pain scale. D, a closed-ended question. So what is the form of the question that requires a more detailed answer? Ooh, you guys are on fire today. Look at you. All right, let's eliminate one wrong answer. So true and false is kind of like yes or no. We need more details, right? We need to ask a question that gets more details than just true, false, yes, no. Best answer? Yes. Open-ended questions. Thank you. Good. Yes, Val. Yes, Ensley. Maylin got it. Milka got it. Pumla got it. Uni got it. Nuyo. Diana. Yes, good. All got it. All right, next question. And just to speak to this, open-ended questions make you think too, right? So you get to use some words before the class session starts. Your client has an abnormal response to a heat treatment. Where will that be documented? A, at the front desk, so the receptionist can inform the therapist if a different therapist works on that client. B, near the hot rocks or where the hot pads are kept, near the heat equipment. C, on a sticky note on their chart. D, in the soap notes of his or her chart. Jumping in there right away. Uni, Diana, Milka, Val, all got answers. Yes. All right. Well, let's establish one wrong answer. Not at the front desk. This is all too common in small practices. Oh, a client had an abnormal response to hot rocks. Tell the receptionist so that anyone who works on him, that she can tell him not to use hot rocks. No. Where will that be documented? Oh, 3 more answers. Let me pick. Let me see. Okay. Yep. Nuyo, mailing, Boomla, got it. Yep. Boom. In the SOAP notes of his or her chart. Yes. This is why we do SOAP notes. I still do SOAP notes, even when I work on a client twice a week. Sometimes it's just the date and nothing new, but it documents the date they came in. This is so helpful for the next time you see them. Please, please, please take 3 to 5 minutes at the end of your session and just do SOAP notes. It's so helpful for the next time you see them. All right, next question. Which type of range of motion assessment is not affected by the client's strength? Active assisted range of motion, active range of motion, passive range of motion. Range of motion is not affected by the client's strength. Okay, these are one of those answers that's super tricky. Think about, oh, we got some answers coming in. Very good, ladies. Very good, gentlemen. All right, let's get rid of one wrong answer. So which type of range of motion assessment is not affected by the client's strength? Range of motion is affected by the client's strength. If I have weak muscles, I'm not going to be able to maybe lift I can't put, my hands over my head. So best guess, you know what these are now. Yes, Puma, yes, Paula, yes, New York. Yes, Milka, Diana, yes. Boom, best answer, the passive range of motion. Doesn't matter what the client's strength is if I'm moving them. If the client has lost a lot of strength in their leg and they can't bring their knee themselves all the way up to their chest, but I can through passive range of motion to assess the joint mobility, to assess any catches in that muscle tissue. Good job. Yes, Val. All right. Ready for another one? Name primary consideration behind deciding on the treatment plan. Name a primary consideration behind deciding on your treatment plan. A, the client's goals. B, the time of day. C, the therapist's goals. D, the therapist's time. Oh, yes, Diana, yes, Milky, yes, New York. Good. All right, let's get rid of one of these wrong answers. A primary consideration behind deciding on treatment plan. Primary consideration is not the time of day. You could make an argument that if it's at the end of the day, we want to use more relaxation techniques, but that's not a primary consideration. Oh, we got 4 more answers. Very nice. Val, yes. Puma, yes. Paula, yes. Ensley, yes. Boom. Best answer, client's goals. Now, you see here this little note. The client's goals are primary. However, if those clients have unrealistic goals, the therapist should always stay within their scope of practice and their training. So if a client is coming in, if a pregnant client comes in and you haven't had pregnancy training, that client's goal may be to relax. But it might be out of the scope of your work because you haven't been trained on it. Okay? Good. So client's goals are primary, but your training and your comfort level in treating that condition are also a part of that deciding on your treatment plan. Now, you may encounter a condition, say flat feet, pes planus. never worked on flat feet before. And the client's like, I'm really hoping to relieve, my foot pain from getting this massage. Are you qualified to work on flat feet? Put it in the chat. What's your opinion? Yes or no? Are you qualified right now, after finishing massage school, to work on flat feet? Are you? I've mentioned pregnancy massage is a condition that needs additional training. Hopefully you got that in massage school too. Let me see. Oh, you guys, yes, thank you. You are correct. Diana, Paula, Milka, Ensley, Pumla, Val, Nuyo all say yes. You absolutely are qualified, because the traditional work that you will do on that client's feet will help to alleviate pain. You do not need to know all the ins and outs, all the bone structure, all the muscle conditions, all the ligaments that are affected by flat feet to do some good in those feet. All right, I believe this is our last question. Ooh, that was our last question. It is. All right. Very good. Well, thank you very much for being here today. I'm going to wrap up our recording. I am going to say goodbye. My name is Jody Scholes. I'm going to hang out here in the classroom for a while longer. My name is Jody Scholes, and I am your instructor for the MBLEX Review course, where we gather every week to prepare you to confidently, calmly, courageously pass the MBLEX, the Massage and Bodywork Licensing Exam. So have a great week, and we'll see you here again next week. See you here again real soon.